What happens if your Medicare Advantage PPO plan, or any Medicare Advantage plan for that matter, disappears for the new year and is getting terminated? Unfortunately, this is a common situation that most people overlook, and you have more options than you realize. In today's video, I'm going to walk you through exactly what to do if your Medicare Advantage plan gets pulled from your area, loses its contract, or gets replaced with a completely different plan. And you'll learn what your options are, your deadlines, and common mistakes that you want to avoid if your plan does get terminated. Hello, my name is Edwin John Rodriguez, your licensed health insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients shop, compare, and enroll on plans based on their needs and goals. I often say to my clients, I'm the best free help you'll never pay for. And of course, remember, the best prescription is a subscription. If you're not already subscribed to the channel, please do so. It really helps a small channel like mine out. Now let's get into it. What happens if your Medicare plan is terminated for the new year? What happens is your insurance company is actually pulling the plan from the service area. This often happens due to contract disputes, low reimbursement rates for Medicare. You probably heard about a lot of changes going on or cuts to Medicare for 2026, affecting the way these plans are being funded. Network breakdowns, or sometimes carriers are shifting strategies. Maybe they want to focus more heavily on an HMO program in the area, or Part D drug plans on in the area, or maybe even PPOs, or in some cases just pulling out of the market altogether. Now, as unfortunate as being dropped from your plan may sound, it may actually open up some opportunities to improve your benefits at that time. So what does it mean to you if your plan is being terminated next year? If your plan is terminated, you're going to have a guaranteed window to make a change without penalty. Now, depending on how your plan actually terminates, you're going to qualify for a special enrollment period. This special enrollment period is generally for a non-renewing plan, and this is a time where you can actually make a change to another Advantage plan for the new year, or possibly even switch to a Medicare supplement program as well for that new year. What are my options if I'm being terminated from my plan for the new year? Your first option is you can go to another Medicare Advantage plan. So if you're on a current Medicare Advantage plan now and you're wanting to switch to another Medicare Advantage plan, you'll be able to do so by shopping your options based on your specific needs and getting set up with that plan for the new year, generally a January 1st effective date. This is usually the most common route that people take when they're shopping their plans. Of course, you want to make sure that you are confirming your doctor's network, that any doctors that are important to you take your plan, any hospitals, specialists, and of course your prescriptions. Again, with the Medicare Advantage plans, the medical and the drug plans are tied together. So you want to make sure that those plans are not only covering your doctors, but also covering your medications well. Now, also keep in mind, not all plans are created equally. So even if you're going from one HMO to another HMO, or PPO to another PPO, or PPO to HMO, you're going to want to make sure that you are verifying your providers, any network limitations you may have, and of course, most importantly, any limits to your prescription portion of your coverage. The second option you have is to switch to Original Medicare and purchase a supplemental policy. At this time, you can choose to go with Original Medicare. Most commonly, it's going to be a Plan G or Plan N supplement. By going that route, you will have to purchase a standalone prescription drug plan. And in most cases, a plan termination will actually give you guaranteed issue rights for a Medigap policy. But some states do have some additional protections, so make sure you check your options based on your area. Back in 2014, there was a popular plan here in Central Florida called PUP, Physicians United Plan, that actually was terminated mid-year in the middle of June. They sent an email out to all of my clients and to all the agents that were contracted with them, letting us know that the Physicians United Plan was actually being terminated retroactive to June 1st. And what that meant is that everybody was being dropped in the middle of the year. Now, again, this is with a Medicare Advantage plan. Although these situations are very uncommon, you want to make sure you know what to do in this scenario. So with my clients, I actually reached out to all of them, let them know about the change that was going on. We were able to update their plans as early as the July 1st effective date, getting them set back up with coverage based on their needs and goals. There were a handful of clients that were actually a blessing in disguise for them. For these folks, being that their plan terminated, it gave them a guaranteed issue situation for a Medigap policy. What that means is they were able to go from this Advantage plan to a supplemental policy without any underwriting. They were able to actually go to a supplement plan. It was almost a blessing in disguise because being with a supplemental plan made more sense for them at this time. So we were able to update them to a supplemental policy as of that July 1st effective date. And because their plan was not renewing or was being terminated through the Medicare system, that gave them a guaranteed issue situation. They were able to go to a supplement plan without any health questions being asked. If you're in the middle of cancer treatments, that's a blessing in disguise. Now, it's important to remember your deadlines and enrollment windows is when it comes to plan terminations. If your plan is being terminated, if it's a Medicare Advantage plan or a Part D drug plan, you have your traditional enrollment period from October 15th to December 7th of every year to make changes to your program. Now, because you have a plan that's not renewing as well, you also have an additional special enrollment period for a non-renewing plan, which would be from December 8th to February 28th of the following year. This is generally a 2 to 3 month window after a plan terminates that allows you to be able to make a change to another program in that duration. These changes generally do not happen in the middle of a season or in the middle of the year. As the example I just mentioned a moment ago, your carriers or your previous carrier will actually notify you generally around the end of September when you would generally be receiving your annual notice of change documents in the mail. They will tell you what's going on for your following year. And if your plan is not renewing, they will tell you in that letter that, hey, your plan's terminating, to go shop some options, and they give some basic guidance on how to do that. Of course, if this has happened to you, please feel free to reach out to us here in our office. We're more than happy to assist you in the process. And I'm interested to know as well, have you ever been dropped from a plan in the past? Have your plan ever terminated? If so, go ahead and drop a comment in the comment section below. I'm interested to hear your story and your take on this situation. Now, believe it or not, there are some common mistakes that people make when it comes to their plans being terminated. One of those mistakes is waiting until January to actually make a change. Your plan already canceled on January 1st. So if you're waiting until January to take action, you're essentially going to be with just standard Medicare for that month of January. And no one recommends being on standard Medicare because the costs are crazy. You have no safety net as far as your out-of-pocket expenses that you would have with an Advantage plan or possibly even with a supplement. So waiting until January is not the right option. So make sure you're doing your due diligence ahead of time to make sure that you have your ducks in order prior to the new year coming around. Another common mistake that people make is assuming that their doctors will still accept the plan that might be auto assigned to you. That's not the case. Now, very seldomly, again, these plans terminate, but if they do terminate, sometimes Medicare will auto transition you to a new plan. Now, thinking that plan is going to be an exact replacement for your plan is bad advice. Make sure that you're doing your due diligence and shopping your options before the new plan or plans go into effect for the following year. Another common mistake is not reviewing your drug coverage. Sometimes people in a haste may jump into another plan without really doing their drug plan the service of making sure that their medications are covered well. Just because a medication is covered doesn't mean it's covered well. You want to make sure that there aren't any quantity limits to that medication. If there are, if it's appropriate to your needs. And of course, what those costs are going to be. Those costs can vary widely from one plan to the next. Another common mistake people make is not checking out your doctors. Again, make sure if you're going from one Medicare Advantage plan to another, that you're checking to make sure that the doctors that are important to you take your plan. Here in our office, we help you with that process. If you do need some guidance regarding this, feel free to let us know. We're happy to help you. Another common mistake people make is calling the carrier instead of an unbiased broker. So for example, let's say you have Humana Medicare Advantage and your plan is being dropped in your area, and you call Humana customer service and say, hey, my plan's being dropped. What are my options? Well, guess what they're only going to be able to talk to you about? Humana. That's your only option that they can talk to you about. Legally, they're obligated to that specific carrier. Now, with us as an unbiased licensed insurance broker, we work with multiple carriers. We help you shop the market. We don't sell any one specific plan. We identify what works based on your needs and goals. Plan terminations are uncommon, but if it does occur with my clients specifically, we notify all of our clients immediately once we find out about this information. We send out letters, emails, text messages to our clients, reminding them about any plan terminations going on for the year. Now, if I still don't hear from my folks, I'll pick up the phone and call you as well as a friendly follow-up, but most folks are able to get that communication ahead of time, a lot of times through the letters from their carriers, and that prompts them to schedule a call with us. Once we have our conversation, we'll then check to see to make sure that all of your doctors and specialists are going to be covered on any potential new options. We verify hospital access. We run through your prescription costs. We compare those against one another. We check to see if it makes sense to go with a PPO versus an HMO or HMO versus a PPO, and just really doing our due diligence and shopping these alternatives for you. If there's options for zero premium plans in your area with Advantage plans, there generally are, we try to look to go that route as well, because not only do we want to save you on costs and co-pays, but saving you on some premium helps too. So the other option is exploring your supplemental plans if necessary. This won't be for everybody. Not everybody needs a supplemental policy, but if somebody is going to be falling into the situation where they're being dropped from an Advantage plan and they're in the middle of a large treatments of maybe cancer, a lot of cardiovascular disorder situations going on, scheduled surgeries, hospitalizations, it might be a blessing in disguise to actually then transition over to a supplemental policy. The The nice part is being that your plan is being terminated, that's going to give you that guaranteed issue situation that will allow you to go to a supplemental policy without any underwriting. Now, again, supplemental plans do not underwrite in every state, but most states do. So please check your state for those details. Now you know what to do if your PPO plan or Medicare Advantage plan is disappearing for the year, and how to avoid the stress that most people go through during this network shakeup. If you found this video helpful, go ahead and give it a like. It really helps others find this type of honest guidance. And also be sure to hit that subscribe button so you don't miss future videos. Insurance rules and options are always changing, and being subscribed to the channel is the best way to make sure you're staying informed. Additionally, if you have any questions that weren't answered today, go ahead and drop them in the comment section below. I personally read every one of them, and I'm happy to help answer any questions that weren't addressed today. So if you're thinking about switching your Medicare plan for the new year, you can schedule a free call using the link in the description section below. We'd be honored to help you walk through it. No pressure, no sales pitch, just clarity. And again, if you're looking for a trusted guide to help you navigate your insurance from start to finish, that's exactly what we're here for. Again, doing so does support the channel in the process. If you got value from today's video, go ahead and consider watching this video here next for more information related to your Medicare journey. Until then, take care and thank you so much for watching.